Over the years, the Nigeria's health sector has continued to experience mass exodus of doctors seeking greener pastures. Today on Sound Health, our focus is on how to check the brain drain syndrome in the health sector. I'm Olasumbo Modupe. Welcome to the show. Still Sound Health on Lagos Television, and on today's episode, a fertility expert and the Convener Physicians Mentoring Program, Dr. Abayomi Ajayi, will enlighten us on how to stem the brain drain syndrome in the country's health sector. Welcome to the show, Doctor.
Thank you.
What is the rationale behind the Physicians Mentoring Program?
Well, thank you very much for asking. This is something I've always wanted to do because I believe that I owe this nation or this industry that, in the sense that, but it now became something that I had to bring to the front burner because of the fact that I'm alarmed at the way doctors are living in Nigeria. Yes, I understand that doctors are human beings and they are affected by the economy, but I'm not sure that all of them need to leave. Some we have to leave. That has always been there, but I'm sure that some, if we handhold them, some of them might leave. And those even want to leave, they might leave and come back. So, but I think most of the time people go now abroad, it's like, oh, they're saying bye-bye forever. But I'm not sure that is the best way to go. Initially, what people used to say that, well, doctors are reluctant immigrants. But now they are willing immigrants. And that we need to put a plan in place for even those who want to go. They have their own plan. But sometimes why people are living the way it's not only doctors that are living, but why people are living is because they are looking at only the environment as of now. They're not putting 10 years into their plan. So that's what we want to try to do. Handhold some of these people. Some of them might not need to go. Even help them, even if they want to go, what are you going to do there? What is your plan when you come back? So that's the idea, that we just want to handhold some people, because some of us also have benefited from this kind of handholding at one stage of our lives or the other.
One of the major factors behind the brain drain syndrome in the health sector has been cited to be poor welfare package and underfunding. What is your take on this?
I totally agree that the healthcare space is grossly underfunded. I also totally agree that the facilities in Nigeria are not up to par. But just like every other problem, there is always the other side of it. There's an opportunity.
Okay.
Why do we want other nationals to take the opportunities? Why are we not training ourselves to fit into those opportunities? And that's what we're talking about now. Yes, there's a problem, but there's a silver lining even to anything if you look close enough. And that's what we want these guys to see now, so that even if they want to go, maybe it's a 2-year, 3-year, 5-year course that you're going to do, and you know that, okay, the best place to use that skill is probably in your home country.
How true is the fact that a public health expert sees about 4,000 patients as against the WHO's standard, where a doctor is supposed to see about 600 patients?
Yeah, well, you're talking about the physician population ratio in Nigeria. Yeah, that's what it is. We're in Nigeria, one doctor, and that's why there's so many people who don't have access to healthcare, because the proportion is really very bad, and so majority of the doctors are in urban areas, so the rural areas are worst hit. So yeah, so really and truly, that's one of the arguments that we have, that a country where the proportion is so skewed, why should the doctors be leaving again? And everybody is folding their hands, not doing anything active, and that's what we would want to do. Yes, we know that facilities will have to come also, But you know what I say now with hindsight, I know that providing facilities is one event. You know, and yeah, once you built it, it's going to be there forever. Yes, it's difficult to build it. I'm not saying it's not difficult, but once you built it, you built it forever. You have to manage it on a daily basis. Human beings have to be there to manage it, and therefore that's when you have lost all of them. Even when the facilities are there, it becomes a challenge to manage it.
How do you intend to capture these doctors that are determined to seek greener pastures?
I'm not sure they're determined. I'm sure they are being forced. All right. And that's what we need to let them see. Because it actually happened to me also when I was a young doctor. And all I was thinking about was, for a different reason, I wanted to go up. Not because Nigeria was this challenging, but for a different reason I wanted to go. It was challenging also, but for a different reason I wanted to go abroad. I didn't like the interpersonal relationship between doctors. And I thought maybe it was part of our civilization at that point in time, and I wanted to go abroad to do some other things. But I did not go finally, because some people spoke some words of wisdom into my life. And that's what I think I also owe some of these young people, to be able to. We're not trying to make decisions for anybody. You make your own decisions, but let it just be guided.
What informed the choice of mentors for this program?
Well, I try to look at people who I know, and who I know they have the same passion for the country, and they have been successful in their own chosen endeavors. And that is the scope is going to increase later on, but we want to start with these people that are, as much as possible, I know they are men of like passion, men and women of like passion.
How do I qualify for the physicians mentoring program?
Anyway, we're going to come online and also offline, that you can apply. It's going to be open to people to apply, and it's free. You just fill the form, apply, and we try to see whether what you see about you matches what we want to start with. Because we want to start with a small number. It's a 1-year program, mentoring program, but we're starting the first batch for only 6 months. So we're choosing only 12 mentees, and we're going to assign them to the mentors. Because it's like a pilot project. So after 6 months, we're going to assess this program for about 3 months and see what do we need to improve on, blah, 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 blah. And then we come back to now start the whole year programs.
Can you be more detailed about the skills to be acquired during the course of this program?
What we want is life skills. We want to give you life skills. So leadership, finance. So, you know, most of the time, the way our educational system is structured, when you're a doctor, you're just a doctor. When you're an engineer, you're just an engineer. And that's one of the problems that we have seen. The majority of the professionals, why they're not able to do stuff, is because they're just engineers or they're just doctors. They don't have the holistic view about what life is. What can I do with this skill that I have? How can I do it? You know, I remember the first day when I first started doing business, and I was given a balance sheet, and as a doctor, I had a headache looking at the balance sheet. There's so many doctors who have a headache. You must not, because we need to be able to train people to be able to see what they can do and how they can do it.
What are your future aspirations for the physicians mentoring program?
Well, that's why we want to look at it in the first 6 months. What impact has it had? Because we want to be able to have an impact. Not only the next set of mentees will probably be about 50, so that we can continue to increase the number. But we don't want the quality to suffer while we're increasing the number. So I just think we owe it to the doctors. I'm sure other professionals also might join suit, to be able to stay on in Nigeria, even if you're leaving, have a plan of when you're coming back and keep to it. And so that the country can become better. You know, what I see sometimes is that, how much does it take to train a doctor? So every day, Nigeria is like we are being bled by some countries when we have trained all these engineers, all these doctors, and then some countries just come in and say fill form, and then they're taking them away. So yes, it's painful because we need these people for us to develop this nation, and this nation we must develop.
Okay. Before we go now, Doctor, I would like you to give a two-part advice, one to the government and one to doctors that are ready or willing to seek greener pastures.
So maybe I'll start with the government. I think the PPP, because I don't see government doing so much on their own, but they can do so many things with the PPP and public-private initiative, and get people who have run businesses to run our hospitals. Because I believe strongly that the hospital business is a very good business, but it needs to be well run. And so if we can do that, yes, the facilities will improve. Nobody should tell me about free health. It's a pipe dream. It's not possible. Not even in Nigeria that we can't even treat anything. So politicians should leave healthcare alone. It's not a field for them to play in. Let professionals play in healthcare, and let's see that we have good facilities. And for the doctors who want to go abroad, well, I wish you well, but sometimes this is the best place for you. Almost everybody, your country is the best place for you. I'm not saying don't travel abroad, but the only place that you have all the rights of a citizen is your country. And therefore, why do we want to become slaves in another man's country? I'm not saying that the economy is great here. That's not what I'm saying. But sometimes it's this also that gives you the opportunity to do stuff. And that's what we want them to be able to see, that it's not just, people talk about, hey, I'll go and buy a car, so the bloody what? What happens after that? I'm sorry for my French. But what happens after that? Okay, who says we can't buy cars here? You know, yes, it might be rough initially, but you just need to persist at what you're doing, and then you'll find your El Dorado.
Okay. Thank you so much, Dr. Abayomi Ajayi, for playing your own part in stemming the brain drain syndrome in the health sector.
You're very welcome.
Okay, that has been Dr. Abayomi Ajayi, the convener and founder of the Physicians Mentoring Program on how to stem and check the brain drain syndrome in the country's health sector. Sound Health continues with trending and home essentials. Please stay with us. This is how far we can go on today's episode of Sound Health. Play your own part in making Nigeria great again. For comments and inquiries, please send SMS 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.